Now, what happens when the thing that you have been praying for turns into your biggest stress? Now, I don't know about you, but a lot of person have prayed for the job of their dreams or just being employed. And there are some persons who are in a situation now where they are praying for employment. And sometimes you're standing in an answered dream and an answered prayer and you don't know it because it doesn't always feel like it. Today, we're talking about World Mental Health Day, and we're talking about mental health at work. What happens when the work environment becomes a toxic environment and a contributor to much of your stress and anxiety? This morning, we have the privilege of sitting and chatting on the topic. So I want to welcome my ladies that are here in studio with me. This morning, we have Shelly-Ann John, who's the manager for the Community Mediation Center. And we also have Dr. Alina Williams, who is a clinical psychologist. Good morning and welcome. Now, as I said in my introduction, for many persons, not having a job is the center of a lot of stress and anxiety. And then they get to the job that they prayed for, and they should be happy about that, right? I now have employment, I now have hopefully a consistent source of income. I can now be a bit more stable, take care of my family and all of that. So a lot of stress should be relieved by that, but instead it's often the opposite when persons enter into work environments that become quite stressful and overwhelming. This year's topic for World Mental Health Day deals with mental health at work. So tell us a bit about that.
Okay. So the World Federation for Mental Health selects an important topic of awareness every year that treats with global issues. And the theme this year is It's Time to Prioritize Mental Health in the Workplace. This theme was chosen and voted by participants from 161 countries, and it signals to us that people are experiencing significant workplace stress. So the theme this year deals with how we can be game changers. As mental health advocates, we have to encourage and foster good mental health practices in the workplace. And that's what we hope to bring this year.
Excellent. And so this comes with a number of activities that's going to be happening even here in Tobago as we celebrate World Mental Health Day. So tell us about some of the activities that are going to be happening.
Our activities, we will be firstly on the mall, that's the Lowlands Mall, and it's Paint the Town Green. We would be there from 10:30 a.m. to 5 p.m. In that you would have activities such as sip and paint, and we know that is one of the biggest things. And sip and paint would go with art therapy. We have stress, depression, and anxiety tests. We also have blood sugar and pressure testing, nutrition, we have mediation, relationship counseling. And when we hear relationship, we normally think of couples and marriage, but we have other interpersonal relationships which would create some sort of stressors. And those relationships would be among your co-workers, with management, and also with your close friends, your circle of friends. So we have some of those interpersonal relationship counseling. We have sexual health counseling, and I know the HIV unit is going to be there. We also have the Employee Assistance Program, which we call EAP, and EAP is critical to workplace stresses, and this is one of the things that we encourage persons to partake in. We have spirituality counseling, where we'll have about 3 or 4 different religious leaders having their own booth where you can have that opportunity to look at your life, your mental health from a spiritual aspect. And we also have financial counseling. We have live games, but I'll leave that for a bit later because that is a big part of our mental health also.
All right, and I see that you have the EPA there. EAP, sorry.
EAP.
Just to add to what Ms. John said, the concept of the event is that we have a mental health village. And we know that usually when it comes to health fairs, the focus tends to be more on our physical health. We wanted to have an exclusive health fair that was really tailored to mental health. So these stakeholders that you see listed here, these events that we have planned, are evidence-based factors related to the improvement of mental health or the maintenance of good mental health. And some of these factors actually lead to poor mental health when we're not in a good place. So for example, financial stressors, that's a leading cause of mental health issues, especially stress and depression. We also have relationship counseling, and we know from experience that relationships tend to be a major stressor for people. So the mental health village is an opportunity for people to really get the exposure to the different areas of mental health and how these things can work together to create a better balanced person.
Okay, so Dr. Williams, tell us, would employees be able to leave work to go and participate in the event?
Yes, we are definitely hoping that that would be done. We are taking the necessary steps to get the necessary approvals from the different divisions. And of course, we're hoping that the private sector would support the initiative as well by allowing the employees to attend the event.
All right, and give us the dates one more time, Mrs. John.
It's on Thursday, the 10th at 10:30 a.m. and it finishes at 5 and it's at the Lowlands Mall.
Okay, so are you hoping that that maybe the divisions or businesses give employees about an hour to go outside of their lunchtime to go and participate and become actively engaged in the activities?
Yes, we are. And we are hoping to see you there and your entire team.
Right.
We are hoping to see the Tobago Updates team where
But
you can come.
I haven't seen any correspondences around, even at the divisional level, inviting employees to be a part of it as yet. So I'm not sure if that's something that you guys are going to do.
Yes.
Yeah.
Okay.
Yes, definitely.
All right.
Just to add to why this is so important, in case we have managers and supervisors listening now, globally, we lose up to $1 trillion in mental health days. That is at least 12 billion days are lost due to depression and anxiety. We are seeing high rates of absenteeism, but also presenteeism, where people are going to work, but not necessarily working because of the high levels of burnout and stress. And you just notice that there's significance in their performance. There's a drop in performance. So we want to stress that having a good mental health in the workplace is not just beneficial to the individual, it's beneficial to the organization. It's beneficial to the employer, to the supervisor, to the manager, because there are many people that stay home, that come late, that have decreased productivity, that make mistakes at work because they're not well mentally, because they don't have good emotional health, because their well-being is compromised. So we want to encourage that and encourage people to see why this is important.
Excellent. Now, this Paint the Town Green event that's happening at the mall, it's not just for employees, it's for everyone. Tell us about, how it's supposed to impact, men, women, kids, youths. What is the strategy to try to engage every cross section of the society?
So just to give the origin of the Paint the Town Green campaign, it's a Ministry of Health initiative, and every year the Ministry of Health selects an RHA to lead this campaign. So this year, the TRHA, along with the Division of Health, Wellness and Social Protection, was chosen to lead the campaign, and it's an honor that we've been chosen to do so because it's the first time we've had the privilege. And so our main aim is the aim of the Ministry of Health is to have mental health awareness in the particular catchment area of that RHA.
Okay.
Our aim is to have activities and events that cater to a wide cross-section of people, and you have the opportunity to go to the booth that is most relevant to you and to engage with people that have years of experience in this field that could lead you through your own experience with mental health, whether you have a mental illness or not, or you're on the spectrum somewhere.
All right, thank you so much. Now we're going to take a quick break right here and we're going to be back right after this. So see you soon.
It's a brand new
Good morning, and welcome back to Good Morning Tobago right here on Tobago Updates. Now, we have been chatting with the ladies of the Division of Health, Wellness and Social Protection, and we have been talking about mental health awareness as Tobago celebrates World Mental Health Day and all that's included in that. Now, on Thursday is when we have Paint the Town Green, and that event is happening at the Gulf City Mall in Lowlands, and that's happening from 10 a.m. to 5 p.m. Now, it's not just about walking around doing sip and paint and chatting with people. There are a lot of engaging activities and games that are going to be happening while you're there. So be sure to come out and enjoy the event. But, I'm going to have Mrs. John tell us about some of those games and activities that we can look forward to when we come down to the mall on Tuesday.
Okay, thank you. So, when we see live games, we may wonder, what does playing games have to do with mental health? But playing games is critical to our mental health because what it does, it helps with emotional resilience, social connection, that bond, playing together. Even if I know Dr. Williams, if once she's playing a game, she has to win, right? Playing together. But just that whole, and it gives you good stress, it gives you bad stress. Good stress is what is important.
Right.
Mental health deals with stressors, but games create good stress. It's a stress reliever and relaxation. It helps with problem solving, and it helps with your cognitive development, and it helps with depression and all those things. And we know of that old proverb that the family who prays together stays together. But there's also the family who plays together stays together, because it creates a bond and a connection that is like no other. And we also know that all work and no play makes what? Jack a dull boy. So we will be having games such as Ludo, and we have the giant games. So we have Ludo. Those are some board games. We have Jenga, Snake and Ladder, Twister, and please come out to see our secretary because Twister is one of her favorite games. Last year, she would have been the champion at it. So if you want to compete with her, you can do that. So we have Twister, we have hopscotch, cornhole, ring toss, tic-tac-toe. We even have some mini golf for you.
Okay.
Yes, we have all of that. And you have this opportunity just to de-stress by playing some games and just focusing on you as an individual and your teammates, and just to have some healthy fun.
So that would be interesting to see the different divisions, have a team represented there, being able to see which division might be able to come out on top. But when we talk about mental health in Tobago on a whole, have you seen a shift in regards to how persons view mental health, having the mental health conversations and acknowledging it as being a real part of the human existence, as opposed to it being as a result of a person being deemed quote unquote crazy or having had a spiritual attack based on the culture and the climate that we live in?
I would say that our perception of mental health is slowly changing. We are not where we need to be as yet, but during the COVID-19 period and post-COVID, we definitely had an influx of people seeking mental health treatment, both at the public sector and privately. And this is because anxiety and depression rates went up significantly. So I think due to the COVID-19 pandemic, people had a better appreciation for how important mental health is, and they are more willing to accept treatment for mental health conditions. However, we still face challenges where there are barriers to treatment seeking, with people still stigmatizing mental health. It's still poorly understood, and as you said, a lot of it is attributed to demon possession, witchcraft, obia, all the things in our culture that we associate with mental illness. So a big part of this mental health fair is to help eradicate some of that stigma. And that's also why we decided to include spirituality counseling in our mental health village, because we know that for Tobagonians especially, we tie a lot to our spiritual health, and spiritual health and mental health work hand in hand. It's not that we have to have one over the other. So definitely we are trying to eradicate stigma. It still exists, but I would say that it's been improving. People are more accepting of mental health conditions.
Okay, and Mrs. John, has any policies been drafted to acknowledge mental health in the workspace, and what are some of the approaches being used to assist with improving mental health in the workplace?
Okay. So as I'm about to answer, I'll just like to add to Dr. Williams. What I want to share is that post the pandemic, we also saw an increase in males seeking mental health. Before that would have been a challenge. We normally would see more females coming out to mental health, but we saw an increase in males and even younger males and average age seeking mental health. So it is, as Dr. Williams said, we are coming out slowly, but we are coming out, and we are hoping that this program is going to help in that awareness. As it relates to policies, I cannot say for sure that policies were implemented, but what has happened throughout in our division is that we have, when we talk mental health, we do a lot of workshops. So we have been on the ground doing workshops, making persons aware. And now within the pandemic, one of the things that is important to mental health is the ability to do work-life balance. And within the pandemic, we would have had work from home. And interestingly, this is one of the things that should be in a policy, where persons have the ability to have flexible working hours, working from home, where they can create that work-life balance. That should be one of the things in policies. Another policy that is critical is for insurances within Trinidad and Tobago to implement mental health counseling as part of the package. Because when we talk of health, our insurances basically look at physical and not mental health. So most of the policies, if not all, do not have that catchment area to deal with mental health counseling. We have in our divisions, we have the EAP. So that's one of the programs that has been implemented and is still up and running. We need to do more work on promoting that, but we still have to do some more work on policies and interventions.
All right. And you're saying that this is what has to be done. So even at the level of what is being done now, are you seeing a greater shift towards including the mental health aspect into the conversation, even with new employment and existing employees being able to take a mental health day? You know what I mean? Sometimes we have to tap into that sick leave to benefit from that. But do you see a future where, in addition to the regular 20 days of vacation, casual days and sick leave, that a person may have, let's just say, 10 or 8 mental health days in the year, or at least being able to justifiably request the ability to work from home even before there is an actual policy?
I am seeing that shift because we are realizing that mental health is critical. And the reason it is critical is because our psychological well-being affects all aspects of our lives, and especially our work. Because if you focus and if you just look at life, we spend most of our time at work. Our families get less of us, and we spend most of our time at work. And if we spend most of our time at work, then it's critical to look at the employee's mental health, So I know for sure in my division, in my department, we have that opportunity to have mental health days in the mediation department because we are in the helping profession. So the therapeutic counselors, the mediators, the staff, because we know that it's like, who guard the guards? Yeah, and if you are providing this type of service, then definitely. So the persons within the unit I am have that opportunity to have that downtime, that mental health day.
I think the issue currently the challenge that we're facing is that a lot of this is at the discretion of the managers or supervisors.
Correct.
And it's not written policy that's enforced, and that makes it problematic because I mean, I do have clients that come to see me, and just to take an hour off to come to the hospital for treatment is a problem, you know? So I think for the most part, we have to try to get this on board, even if it starts with the Tobago House of Assembly and then progresses to other areas. It's really something that we should look at because, again, we are losing more due to loss of productivity, absenteeism, presenteeism. People are just not performing well at work because they're burnt out, they're stressed.
Right. And I'm glad that you brought the topic of being burnt out. I remember experiencing burnout in 2022. I did not really understand what it was until I started doing some more research. And persons often are burnt out, but they don't know that they are burnt out. So they are even more stressed because they think, okay, I'm procrastinating, I'm being lazy, right? I have all these things that I know that I need to do, but I'm not doing it. So there's that added pressure on self of not being able to deliver. And, you know, signs of burnout, you know, can be, you know, simply not even wanting to open up your WhatsApp or just having anxiety thinking about opening your email.
Yeah.
And, you know, putting off having to respond. You see messages and you know that you need to respond, but you just cannot muster up,
Yes.
you know, the strength to respond. And it happens in very subtle ways, or it can be very severe to the point where a person just doesn't even want to leave home to go to work. So can you also, you know, tell the public of what signs they can recognize in themselves or others of burnout?
Okay, so the first thing you want to look at is if there's any change in your behavior. That could be, you know, being withdrawn from your colleagues at work, decreased productivity. It could be being late frequently. It could be absenteeism. But you want to look at changes in your actual behavior or your performance at work. Burnout has 4 main components. There's the physical component. I'll just talk about that. So, for example, you find that you're not sleeping well, you're not eating well, you have a lot of tension, pains and aches, frequent migraines or headaches. It may be issues with your digestive system. Then there's cognitive components related to burnout. This has to do with your thoughts. So you've become more pessimistic, very negative oriented, or as it relates to your thoughts, you're not able to concentrate, you're not able to focus, you're making a lot of mistakes at work, or you may have brain fog. Then there's the emotional component, and the emotional component has to do with how you feel about work now. And this could be, you know, apathy. It could be no motivation or low, but for most times it's just no motivation, right? You literally go to work because you have rent to pay or you have to buy groceries. The emotional component could also be how you feel towards your colleagues, how you feel towards yourself, how you feel towards your organization. And then we have the behavioral component, which is how you act. So the things you do or don't do. So let's say before you participated in meetings, you were present at events, and now you stop doing that. It may be an indication that there's burnout. And so you want to look at changes in these 4 areas. You know, have you been isolating yourself? Are you neglecting your appearance? You know, I remember during the COVID-19 pandemic, a lot of people just didn't care how they went to work anymore. They just stopped doing the makeup. They stopped putting effort because people were mentally and physically fatigue.
Yeah.
We were hyper vigilant all the time.
I remember getting ready for Zoom meetings like 2 minutes before.
Right.
Yeah. That's when we will get ready.
Yeah.
I mean, but I totally understand. And, we see persons at work, experiencing a certain level of withdrawal. And you often you hear or you will see a lot of negativity surrounding that. So instead of maybe rallying around that person or trying to have the conversation to find out, hey, I find that your energy is a bit low, or, I don't see you engaging as much anymore. You're usually, the center of the discussion, and now you have totally withdrawn. You don't really contribute to the discussion anymore. And, you're just kind of behind your desk. No one sees you, no one hears from you. Do you recommend persons to reach out to their colleagues? Or, because, there is a culture of, I don't want people in my business.
Yeah.
So how do you bridge the gap between being empathetic and, wanting to provide support for your colleagues, but yet giving them the space to feel what they're feeling and experience what they're experiencing without feeling like there's too much pressure
or
on them?
judgment? So definitely one of the first things is that managers, supervisors should be trained in mental health awareness. Supervisors and managers should be able to recognize when their employees may be suffering from burnout or even experiencing a mental health condition. And I would say, just from my recommendation, Ms. John could give hers as well, but I usually recommend that you use I statements. So just talk about what you have noticed. So I would say, I've noticed that you're not talking as much, or I've noticed that you're coming to work late these days, or I've noticed. That way you're not really accusing the person of anything. The things that you notice could be inaccurate, or there could be a reason for it. There's no judgment. It's just you saying, I've noticed that. And then you allow space for, do you want to share what's happening? So, I'd say, I've noticed that you've just been in your room all week and you're not talking to anybody. Do you want to share what's happening? That's it. If they say no, I just let them know, well, I'm here in case of anything. Sometimes that's all we need to do.
I really like that. You have any tips as well
It's
for managers?
critical. I like that fact that managers and supervisors should be trained. But there is a skill and a quality managers and supervisors should also have, and that's empathy. That ability to put yourself in somebody else's shoes, that ability to be non-judgmental and to genuinely care about your staff. If we have managers who have that empathy, then it would be easy, because based on what Dr. Williams just shared, some managers would not be able to speak to that employee. And when you are in that position, when you cannot go to that staff, you have to find someone, because we know that in the workplace, everybody have a somebody. All right. And that sometimes you have to use that somebody to help this person to find out what is really happening. And sometimes when you ask the question, I've noticed a change. What is happening with you? Tell me, you care to share? And this person would open up and you would be shocked to know what they are going through. And then you can now understand, oh, this is why they are late. This is why they have to leave early. Because sometimes we have issues where you have, we think that the only person that we care for is our children. But now we have aging parents that we have to care for. And we have so much things happening at home. And we want to just encourage persons to talk to somebody.
Right.
Yeah, just talk to
Mrs.
someone.
John, you are the manager over at the Community Mediation Center. How effective is mediation?
Mediation is extremely effective. It helps person. Now, mediation matters. It's an alternative dispute resolution system, and it's an alternative to the court. When you come to mediation, a mediation can last from 1 to 3, 4, 5 hours. But we try not to go beyond 3 hours. If we see a mediation going beyond 3 hours, we would stop the process, because it's not wise to make decisions after that period of time, and we'll come back to the table. What mediation does, it allows person a voice. It gives you the opportunity to speak. Now, you may come to mediation for one issue, but from the time you start to express and explore, you realize the issue you came for is deep rooted in something that would have transpired 10 years ago. So it gives you the opportunity to share, and it gives the other person the opportunity to listen, because we encourage parties to listen without thinking of a response. Listen to understand. Listen and listen with empathy. So it allows you to share your story. It allows the person to share their story, the party A and party B. And when these stories are shared in a controlled environment, the mediator's skill, the tact that the mediator would use in the process would help parties to now see things from a different perspective. And when you see things from a different perspective, now you are in a position to change your view and to start over and to continue in a better vein.
Right. And we often think about mediation, as you say, as an alternative to going to court. But have you had situations where work colleagues who have created a very tense working environment, not just for themselves, but for their colleagues, have had to come to mediation, and has that been effective in settling workplace disputes?
It has been, and we have had that instance. We have had it within the THA, within our department, within our division, and external division, where we would have had to go in and do mediation among supervisors and employees, among different parties. And we do this on a regular basis. It has proven to be successful. Coming out of many of our mediation, we find that there are some underlying issues where we recommend to the person that you should probably do some counseling to help to deal with that. So once parties agree, we refer them to counseling. And we don't just do individual counseling, but we do family counseling, we do conferences, family conferences. And if we think it's necessary to bring in the neighbor,
right,
we encourage
and
that.
Here's what I want to find out. When it comes to culture, there are persons who, because of the intensity of the dispute, it is very difficult to approach the opposite party and say, okay, here's what, let's go to mediation. Can mediation be mandated by the court in a situation where it is extremely intense and, you know, maybe one party really wants to settle it without it becoming a court matter?
Okay, so as it is, when you have an issue and you need mediation, the parties would come to the mediation center or make a call. They would report the matter, state exactly, we do an intake process, and they would provide the name and the contact number of the person they are in dispute with. When this happens, we have the responsibility to call the other party and encourage them to be a part of the process. The interesting thing is that mediation is voluntary, so persons can deny. But the persons who are calling are skillful and tactful, and encouraging you to create peace is one of our goals. So we do that, and most people, I would say 80% of the persons would comply and come to mediation. As it relates to the court, we have court annex mediation, where 70% of our cases come from the magistrate's court. So you go to the court, the magistrate here, and then they recommend this is something that needs to be dealt with in mediation. The court would now direct you to mediation unit and also send us a letter requesting mediation with the details of the matter, just the brief details of the matter. We would then call the parties. When the court sends you, it is still voluntary. However, persons respect it more, so they are more inclined to attend. But there are some persons who just say, I want the magistrate to deal with this. So they would come, they would listen, and they would end up still saying, I prefer the magistrate to pass a judgment or to deal with this.
All right.
Yeah.
Now we're going to take a brief break right here, and we'll be back as we wrap up this interesting conversation on mental health. See you soon.
It's a brand new
Good morning, and welcome back to Good Morning Tobago right here on Tobago Updates. Now, this morning we have been chatting about World Mental Health Day, mental health awareness, and mental health in the workplace, and all that has to offer. Now, we particularly focused on the event that's happening on Thursday at the Gulf City Mall Lowlands. That's starting at 10 a.m. and finishing at 5 p.m. And we're hoping that all and sundry comes out on Thursday to support the event. Now, it's not just about coming on and hearing persons talk, but it's about really engaging, understanding mental health, and understanding how you can play an active role in bettering your own mental health and the mental health of your colleagues and the environment that you work in, and helping to reduce some of the stress and anxiety that comes with work. Now, this is something that affects everyone. No person is, absolved from experiencing the stresses and anxiety that come with working, especially in intense environments, specifically in the health field. You often don't hear persons talking about the impact of, losing patients on nurses and doctors. So is that something that is often explored at the Division of Health and Wellness, Mrs. John? Is this something that you guys often explore?
Dr. Williams,
What we do offer is EAP. So when there is an event that has taken place that may include the death of a colleague, or even for staff members that have their own experiences, we try to encourage people to access EAP services, and I want to encourage all staff that have access to EAP to utilize it. Even if you feel like you're good, it's not going to hurt you to have somebody to talk to and to offload to. So we do try to encourage EAP, and taking care of yourself is something very individual. So even if the organization doesn't have something in place at this point, your personal responsibility to yourself is to ensure that you are well physically, mentally, emotionally, spiritually, financially, etc.
and also what we have at our unit, we have therapeutic counselors in the mediation unit. So we do for deaths and any form of intervention for persons within different units. We would normally do crisis intervention. And when we do that crisis intervention, we encourage parties. We normally would do it in groups. We encourage parties to seek out EAP also.
Excellent. We want to thank you guys so much for coming on this morning. Thank you for, chatting with us on mental health. And we are really hoping that individuals engage. We're hoping that employers allow the opportunity for their employees to come down to the Gulf City Mall Lowlands, even if it's just for an hour, and engage in the events. But before we leave, we want to allow you to give your last remarks, if there's anything that you want to.
Yes, I want to encourage parents to bring their children as well, because we will have the Child and Adolescent Center in attendance. So parents, if you have concerns about your child, if you've always had questions about their well-being, emotional well-being, mental health, you are encouraged to bring your children as well, or you could come and ask questions to people that specially deal with children and adolescents. We'll also have substance abuse counselors too. So for those people struggling with any form of addiction, please come talk to the necessary person and get started on your journey to wellness.
All right, excellent. Last question. What department is responsible for, diagnosing kids with autism? And would anybody who deals with that be possibly available to chat during the Paint the Town Green event?
Yes, definitely. So in the TRHA, that would be the mental health unit. And in the mental health unit, we have a special subsection that deals with children and adolescents, called CAC, Child and Adolescent Center, and they would deal with all mental health related problems in children and adolescents. So definitely someone would be there to answer questions.
All right. Thank you so much again, ladies. Guys, we want to thank you so much for being a part of the discussion this morning. Thank you for liking, sharing, and commenting, and just sticking with us through to the end. I have seen your comments, and I'm glad to know that you also enjoyed this discussion on mental health. And as I said before, this is an event that you don't want to miss. You tell your boss about it just in case they haven't heard about it. And I think that you should have the right to participate in this event. So I want to thank you again so much. And thanks for all that you have been doing and continue to do, not only to help us to rebuild, but to also help us to continue being the #1 broadcaster here on the island of Tobago. See you soon. Goodbye.